My name is Dr. Angela Zechmann, and I practice obesity medicine. When people come in to see me, they come in because they want to lose weight. What they don't understand is that they're suffering from a really serious disease process, a disease that has a lot of complications to it, for example, high blood pressure or insulin resistance or sleep apnea. So what I do is my doctor stuff, and I help them understand what the diseases are. I get them all diagnosed and treated. And over time, as people start feeling better again, they lose weight. And what I like to say is we get to watch them come back to life. They don't realize it, but they've been living a diminished version of themselves for a long time. And once they start feeling better again, they're like, oh, wow, I can't believe how sick I was before. So as they lose weight, they're doing great, and then they go away. We lose them. And they come back 6 months, maybe a year later, and they've put some of the weight back on. Oftentimes what they say is, I know exactly what to do, I just can't make myself do it. They feel horrible, and they feel defeated. Maybe this has happened to you if you've ever lost weight and gained it back again. I've developed a new program. It's called The Inside of Thin. What that means is that in order to maintain weight loss for good, there needs to be an inner transformation. What we don't understand is that there are sometimes unconscious forces that are at play that are preventing people from maintaining their weight loss. It's an online webinar. You'll take a class once a week for 7 weeks. I'll take you step by step, week by week, through the process that will assist people in discovering and addressing the unconscious blocks that are preventing them from maintaining their health. And let me give you an example of what I'm talking about. The patient comes in, she's a woman, she's 45 years old, she has a couple of teenage kids at home, she has a full-time job. She comes in, she's about 40 pounds overweight. I find out she's got undiagnosed insulin resistance and she has some sleep apnea going on, so there are some medical problems going on. So I do my medical stuff and I get that treated, and she feels great, and she loses about 30 pounds over about 5 or 6 months. And I see my patients monthly. Well, 1 month she misses her appointment. The next month she comes back and she says, this was really hard. I've just put 10 pounds back on. And I said, well, what's going on? And she says, well, I've been working overtime. I don't get home until 8 o'clock every night. And once I get home, I'm dead tired, exhausted. There's no way I can think about exercising. There's no way I can think about cooking. And so what I do is I eat crackers and cheese, and then I comfort myself with ice cream. And I've been doing that for a while now, and I feel horrible. And she's actually in tears as she's telling me this. Well, I ask her, let's delve a little deeper here. Why are you working overtime? She says, well, I've got a coworker who's not doing her job. And so I'm staying over to make sure that the work that she was supposed to do gets done. So, what's going on here? Why is it that she feels responsible for covering for her coworker? That's the type of thing that we need to get to the bottom of, because as long as she feels responsible for covering for her coworker, she's not going to be able to maintain her weight loss. She knows what to do. She's just having a hard time getting herself to do it. You can get started in this program at any time. If you're in the early phases of weight loss or just thinking about weight loss, really good to get going, understanding how you're going to maintain your weight loss. If you are in a program right now, excellent time. If you've lost weight and want to make sure that you're able to keep it off, excellent time. Or if you've lost weight and started gaining some of it back, it's also a perfect time. Essentially what I'm saying is there's no wrong time to get started with this. Getting that inner transformation in place that is the key to maintaining your weight loss is what's so important. I urge you to get started. I urge you not to think about losing weight again until you have a really good sense of how you can maintain your weight loss. There's no shortage of diets and weight loss programs out there, but there is a shortage of information about how to maintain your weight loss. I hope you will consider this deeper dive that will allow you to never again have to utter the words, I know what to do. I just can't make myself do it.